Welcome to Mutu Bata Rata session. We will be fast and we will complete it in very short time. This is a video to be watched a day before exam. Thyroid gland, it is located from C5 to T1 vertebra, anterior to C5 to T1 vertebra. Capsule, it has true capsule and false capsule. The false capsule is formed from the pretracheal fascia, and during surgery we should be outside the false capsule to avoid the injury to the parathyroid gland and the recurrent laryngeal nerve. Blood supply, it has two supply, superior thyroid artery and inferior thyroid artery. When we talk about artery, it has two supply, superior thyroid artery, super teacher teach clever student. So superior thyroid artery from C carotid, external carotid artery, it's the branch of the external carotid artery, whereas inferior thyroid artery, it is the branch of the thyrocervical trunk, which is the branch of the subclavian artery. Now vein, it has three drainages: superior, inferior and middle. Superior, middle and inferior. Wait a minute, in artery there is an artery called as thyroid ema artery. There is a artery called as thyroidea ema artery. That thyroidea ema artery sometimes arises from brachiocephalic trunk, it sometimes arises from arch of aorta. From brachiocephalic trunk it arises more, हैन? कहिलेकाहीँ हाम्रो एमसीक्यूमा आयो भने choose that. Now in venous drainage, superior, middle and inferior thyroid vein, superior and middle, they are the tributaries of internal jugular vein, whereas inferior jugular vein, superior and middle, whereas inferior jugular vein, it is a tributary of brachiocephalic trunk. Nerve supply, there are two supply, superior laryngeal nerve and recurrent laryngeal nerve. Superior laryngeal nerve, it divides into internal and external laryngeal nerve. Internal laryngeal nerve supplies the sensory part of the larynx, whereas internal laryngeal nerve supplies the sensory part of the larynx, whereas external laryngeal nerve, it supplies the muscle, and that muscle name is thyroid muscle. How I remember? Superman saves CT. Superman means superior laryngeal nerve, CT means cricothyroid, and it is the muscle of it is the intrinsic muscle of larynx. Other intrinsic muscle of larynx, it is supplied by recurrent laryngeal nerve. It is supplied by recurrent laryngeal nerve. Superior laryngeal nerve, there is again a mnemonic called as SIP. Superior laryngeal nerve in inferior or recurrent laryngeal nerve pool, meaning superior laryngeal nerve, when we ligate superior thyroid artery, then we ligate towards the thyroid, towards the upper border of thyroid. अझै अलिकति राम्रोसँग भन्दाखेरि चाहिँ we ligate towards the, we ligate close to the pole of the thyroid. त्यस्तै अब inferior thyroid artery लाई हामीले ligate गर्दाखेरि चाहिँ we ligate away from the inferior pole of the thyroid, किनकि superior laryngeal nerve, it is located away from the pole, whereas recurrent laryngeal nerve, it is located close towards pole. So to prevent injury to the recurrent laryngeal nerve, we ligate away from the pole. यसको लागि mnemonic SIP, superior laryngeal nerve inside, superior laryngeal artery inside, nerve भनेछु, sorry, it's superior laryngeal artery inside, र SIP, recurrent laryngeal artery pool भनेपछि superior laryngeal artery ligate चाहिँ towards the upper pole, र inferior र recurrent laryngeal artery को ligate चाहिँ away from the lower pole. अब we have parathyroid gland. Parathyroid gland, there are four parathyroid gland, two superior, two inferior. Parathyroid gland is supplied by inferior thyroid artery. अब lymphatic, when we talk about thyroid cancer, then the first draining area is prelaryngeal. Prelaryngeal भनेको larynx को अगाडि, अरु के हुन्छ ट्र्याकिया को अगाडि र ट्र्याकिया को साइडमा प्रीट्र्याकियल र प्याराट्र्याकियल. प्रीलारेन्जियललाई के भनिन्छ? डेल्फियन नोड. र त्यहाँबाट लिम्फ कहाँ ड्रेन हुन्छ? डिप सर्भाइकलमा. अप्पर डिप सर्भाइकल, मिडल डिप सर्भाइकल, लोवर डिप सर्भाइकल. जुन यो प्रीट्र्याकियल प्याराट्र्याकियल चाहिँ लेभल 6 हो, जुन हामीले कुरा गर्छौँ नि, लेभल्स अफ लिम्फ नोड इन द नेक हो, त्यसको लेभल 6. त्यस्तै अप्पर मिडल र लोवर भनेको 2 3 4. अब अप्पर डिप सर्भाइकल नोडमा के पर्ने भयो त भन्दाखेरि जुगुलो डायग्यास्ट्रिक नोड पर्ने भयो भने लोवर डिप सर्भाइकलमा के पर्ने भयो ओमो जुगुलो ओमो के पर्ने भयो जुगुलो ओमो हाइवेड नोड हैन. अरु कुरा भनेपछि बेरिज लिगामेन्टको बारेमा. बेरी लिगामेन्ट इज द कन्डेन्सेसन अफ द प्री ल्यारेन्जियल फेसिया, प्री ट्र्याकियल फेसिया भन्छौँ हैन. इट इज द कन्डेन्सेसन अफ प्री ट्र्याकियल फेसिया that connects the thyroid gland to cricoid cartilage and trachea and few rings of trachea. Recurrent laryngeal nerve चाहिँ बेरिज लिगामेन्टसँग क्लोज प्रोक्सिमिटी हुन्छ. रिकरेन्ट ल्यारेन्जियल नर्भ भएको तलतिरको नर्भ जसलाई चाहिँ हामी ल्यागेट अवे फ्रम द इन्फिरियर पोल गर्छौँ. मिडल थाइरोइड वेन, इट इज द फर्स्ट वेन टु बी ल्यागेटेड. कोचर्स वेन, इट इज अल्सो नोन एज फोर्थ थाइरोइड वेन, कोचर्स वेन, and it drains into the internal jugular vein. Thyroid contains follicle, it contains colloid contains immunoglobulin.